Hi, Dr. Matt here. 80% of all people who have hypothyroid actually have a form of an autoimmune condition called Hashimoto's. And a lot of times people don't even know that. Your doctor may not have even told you that you have Hashimoto's or autoimmune thyroid, because in the current healthcare system, it doesn't really change the treatment. The treatment's the same. You take thyroid hormone and you level out your blood work. And that's fine, except that we need to take a closer look at autoimmunity. So autoimmunity means this, very simply. There's two parts to your immune system, okay? And in autoimmunity, one side goes up and the other side goes down. As that happens, your immune system starts to attack the thyroid. And when you attack the thyroid, you lose thyroid tissue. Now, as a result of that, over time, this is a chronic condition, you become hypothyroid and you start to have symptoms. So, like you might have fatigue or bloating, your hair may fall out, your skin could be dry, you could be swollen. And what we need to understand is that there's a genetic predisposition or component here to the thyroid disease. Usually you might find somebody in your family history that either has a thyroid condition or some other autoimmune condition. And so if you have the genetics, then there usually needs to be a trigger. So what happens is your immune system is normal like this. In autoimmunity, it goes up like this and it gets stuck. Now, what's causing it to get stuck there? It's usually a virus, an infection. Stress can trigger the immune system. There are dietary challenges that can trigger the immune system. Very commonly with autoimmunity, it's gluten or dairy or other foods. Hormones can also be a trigger. And anything that triggers your immune system to become imbalanced or dysregulated will affect your thyroid condition. What my concern is for patients is that if they have an autoimmune condition and they're taking thyroid hormone, but yet they still don't feel better, what's going on with their immune system and what other parts of the body might be affected. So the autoimmune attack doesn't usually stay confined to one tissue type. So it'll usually start to go into other tissues of the body. So it's common to see that that patient will have joint pains, or they'll have digestive problems, or maybe we're getting an immune attack in the intestines. Commonly, you start to get attack in the brain or the nervous system, creating brain fog or neurological symptoms. And you go from doctor to doctor being shuffled around to the neurologist, to the endocrinologist, the rheumatologist, all well-intentioned. But if the immune system is being ignored and we don't calm down and balance the immune system, the body keeps attacking itself. And I would say that there's a scale here, or a spectrum of autoimmunity, so that you might have joint pain, but you don't have rheumatoid arthritis or osteoarthritis. You might just have inflammation that's going on that's starting to destroy or cause pain in the joints. And remember that the triggers are infection, stress, hormone imbalances, and oftentimes a biotoxin, something like a mold allergy or an allergy to some environmental chemical. So if we're going to address hypothyroid, we must take a really strong look at the immune system, understand autoimmunity, and do things naturally to support that. The other challenge with autoimmunity that we find is there aren't really any good medications for it. So we have to control autoimmunity through lifestyle. That means looking at your diet and seeing what foods you might be sensitive to and what foods might be aggravating your immune system. Also, there are different supplements that you can take to support your immune system and calm it down. When we do that, we see patients feeling better. We see the puffiness and the bloating coming down. We see the weight starting to be reduced. Energy levels come up and sleep is improved. So now that you understand a little bit more about autoimmunity, I invite you to come into the office. Let's have a consultation. We can sit down, go over what your healthcare goals are, go over your family history and your own personal health history, and from there we'll come up with a plan of exactly how you will move into a better direction in your health.